Welcome, 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 everyone. This is the first time that the Health Benefits Unit and the Total Wellness Program has hosted an open enrollment health fair just for our adjunct faculty. Karita Hughes is here from the Health Benefits Unit. She will be discussing today, along with her compadres, Nestor as well as Alfredo from the Health Benefits Unit, the rules around, the eligibility and the enrollment process for new eligibles, as well as the active open enrollment for adjunct faculty, and what that all means. But we're also pleased to have with us today our health plans from CalPERS, our representatives of the health plans from CalPERS. It is always good to hear from the experts, right? But right now, we are very, very happy to present to some and introduce to others none other than Miss Karita Hughes, the new supervisor of the Health Benefits Unit, and I'm going to let her take this away. Go ahead, Karita.
Hello, all. First of all, please confirm that I am sharing my screen.
Yes, you are.
Thank you. This year, welcome to the first adjunct specific open enrollment workshop. You will see that I refer to it as Open Enrollment 2022 because that's what year it is, but it's benefits effective January 1st, 2023. So any changes that you make, adding, removing, enrolling into a new plan, etc., it all goes into effect January 1st, 2023. My compadres may refer to it as Open Enrollment 2023, but I'm specific to the year. As noted, I am the senior HR technician in the unit, also interchangeably known as the supervisor. Normally, under my name, there would be a manager. I lost my manager, my beloved Leo Costantino, this past June. They have not added a new permanent manager for the health benefits unit. I'm still working on that, working on finding out who that is. So at this point, it is me and my partners who will be in the chat with you. With that said, let's move forward with Open Enrollment 2022 or 2023, however you want to use it. This year, the open enrollment is for adjunct faculty members. Open enrollment for medical is mandatory. The reason that it's mandatory is because we're making a lot of changes to the plan. Some of the changes are simply cosmetic, such as the name change to go with the up-to-date names that CalPERS is using. Other changes are more significant. Your faculty in the district have negotiated age-based triggers for your eligibility for medical plans. These negotiations do not affect dental and vision, but the age-based triggers do affect the medical plans. So it is mandatory that you go through the portal to, number one, continue your dental vision. Number two, see if you're part of the age-based medical plan changes. Sometimes in the age-based medical changes, your only option will be to waive your coverage because the district is now contracting with CalPERS to use the retiree benefits for actively working adjuncts or adjuncts within the age-based trigger. So we're moving you from the active benefits plan to the retiree benefits plan, which will be handled separate from this enrollment. So you will waive that and you will continue your dental and vision. It is mandatory that everyone goes through the portal to make sure that they get what they want for 2023. With regard to health benefits in general, many faculty members want to know how to qualify for health benefits. I'm going to back up right here and indicate that I sent Petrolia some things to drop into the chat. The first thing to drop into the chat would be the actual presentation, this presentation. The second thing that I would need for her to drop into the chat, I believe, is Article 13 of the faculty contract. Article 13 is the way that you determine how you qualify for health benefits. As you can see, you must work 3 semesters of the previous 8 semesters at a minimum of 20% of the full-time equivalent for your district. In the 4th semester, you must have 33%. The 4th semester and thereafter, that you will be given an opportunity to enroll. Determining the FTE is based on the faculty load, the full-time load for that discipline. Each discipline is different. Consequently, I'm directing you back to Article 13 of your faculty contract to take a look at your discipline, determine what a full-time load is for your discipline. You divide the number of units that you've taught, that you're teaching in your discipline, to determine if you're at 33% or below. So that should have been dropped into the contract just to let adjunct faculty know how they qualify. The next thing that is being dropped into the chat from Katralia is the actual cost of the plans for 2023. There are 2 that are listed as number 4. The district is contributing $530.86 for 2023, and it is being dropped into the chat to see how that affects your payment. What is being dropped into the chat has 2 sides. The side on the left is the actual cost of the plan. The side on the right is where I have calculated for you to see what you will actually be paying.
Okay,
So,
Karita, let me
yes,
just pause you for just a moment here. What I'm seeing here in the handouts that you provided me was the adjunct newsletter and the Article 27 AFT contract. I don't see a rate sheet.
there were 2 emails. I do apologize. It should have been 1 email of 1 or 2, 1 email of 2 and 2 of 2. Did you receive
Okay,
2 emails from me?
I see it. Let me get that to everyone. Give me
So
one.
just to let everyone know, those things are being dropped into the chat. I just sent those to her like about 10 minutes before this presentation. And so she hasn't had time to organize my file.
Okay, because
Getting into the portal involves 3 methods. Depending on what you use, I'm not going to go through this now. We can go through it later. But the first and primary thing that you'll have to do is to disable your pop-up blockers. Whether you're using Chrome, you go through the settings. Because I'm not computer literate, I just search for pop-up. It brings up pop-up blockers and redirects, and it tells. And then I tell under the Chrome system, I tell it that I want the myportal.laccd.edu to allow pop-ups. With regard to Firefox, you do the same thing. You're going under the settings to look up pop-up, and you're telling it that myportal.laccd.edu should allow pop-ups. If you do not disable the pop-up blockers, when you are in the portal, certain things will need to pop up, certain windows will need to pop up. They will not pop up, and you will find yourself in a loop where your page just stays where it doesn't move forward. So you do want to prioritize disabling the pop-up blockers before you go to the portal. The same set of instructions have been provided for Microsoft Edge. And again, the commonality of the instructions is go to the settings, type in pop-up, and you will see where it tells you, where it asks you if you want to go to pop-ups and redirects. Once you enter the portal, I provided for to Katralia. Hopefully she's able to drop that into, yes, she did have that. The adjunct newsletter, and I recognize that it's misspelled on the screen. The adjunct newsletter has instructions on the final page of how to get into the portal. I want to take this time to emphasize the portal is not going to be open until October 19th. If you try to go to the portal now, you can go ahead and log on, but you won't see anything that says start your open enrollment. I do advise practicing getting into the portal, but the adjunct newsletter has the detailed instructions, including pictures on accessing the portal. When you're selecting the plans, you do the research. We have workshops with vendors as they are here today, as well as I believe there's a workshop in another week or two, which will be geared at actives as well as adjuncts. Today is a very specific workshop. We'll have documents in the portal that will supplement some of the things that you need, and we'll have a summary of the benefits, which is a side by side of which benefits are the best, or not which benefits are the best. It's a side by side of how to what the benefits offer. Those things will be in the portal. We will not have the vendors in the portal. The vendors will be here today, but the rest of the things will be in the portal, and they will be clickable links for you to click on. Maintaining your eligibility. We review the plans at the beginning of each semester. If you're eligible to continue, meaning you have 33% or greater, you will not hear from me. You'll be glad to not hear from me. If something happens, a loss of FTE that drops you below 33%, but you still have classes or an assignment for counselors, nurses, librarians, you still have an assignment, but it happens to be below 33%, we will offer you what's known as the access plan. The access plan is the exact same benefits as this plan. It includes the exact same district contribution. The only difference between the access plan and the POP plan, which is what our normal adjunct plan is called, is the POP plan is pre-tax, meaning it lowers your tax obligations, and we take the deductions from your check so that you get to keep some of your money and the IRS can go pound sand. Whereas the access plan is post-tax, and you're writing a check or providing credit card information to a third-party agency that will be noted when we send the letter for the access plan. So it's post-tax, but it's still the same plan. You just don't have that benefit. COBRA, there is no district contribution. So you're paying the full cost of the plan plus a 2% administrative fee. This is if there is no assignment whatsoever. Again, your union has negotiated as much as possible to try to keep you assigned, so, to keep you in benefits. And so they did negotiate the access plan, I believe, in 2018 so that you won't have to just automatically be placed under COBRA. The only issue with the access plan, and again, it will be included in the letter if you receive a letter from me, is that it ends at in December of that year. So, but outside of that, again, you'll receive a letter that details the access plan a little more. With regard to payroll deductions, I know that payroll deductions tends to be a mystery. So the one thing that you walk into knowing about our payroll deductions is that we do not take deductions during the summer. So for that reason, we have to have them tenthly, which means they look much more expensive, but that's because there's no July and August deduction. So the first thing I want to take a look at is what I call the January adjustment. If you're in the benefit in the fall and you continue into January, what happens is because the plan increases in January of the next year, you'll see a slight increase. One year it increased like crazy, and all of y'all were mad at me like I negotiated it, and it came from the negotiations from CalPERS, so you can yell at the guys when they speak to you later. But outside of that, it's a modest increase for the January adjustment. If you are enrolling for the first time in January, then your January warrant would include payment for the month of January as well as the month of February. So that's 2 months minus the district contribution. It looks a little higher and it panics people, but it's a one-time deduction that way. Then we're able to get you onto the tenthly deduction. The rates have been dropped into the chat for the tenthly deductions for active employees. basically, like I said, because we don't take deductions during the summer, we have to do what I call funky math, where it looks a little bit higher and to keep you covered during the summer as well as during intersessions. For those of you who will be on the retired plan, that will be the standard cost of the plan minus the district contribution. And we can discuss that in the question and answer session as opposed to going over this now. With that said, I believe that's the end of the presentation.
Thank you, Karita. Now, with that, we're going to talk about the actual plan coverages that you are eligible, for those who are eligible, that you can participate in. Let's move to Alex Garcia from Blue Shield of California.
Hi, Katralia. Thank you. Thank you, everyone. I'm going to start sharing my screen. And if I can just get a check that everyone can see this.
Looks good.
Awesome. Thank you. So again, thank you everyone for giving me this opportunity to present to all of you. My name is Alex Garcia. I am your Blue Shield representative. I'm going to go over the plan options available through CalPERS on the Blue Shield Health Plan. What I like to do is just give you a quick overview of our mission. So Blue Shield is committed to provide you a flexible network, product, and service solution with comprehensive plans and using a large doctor network throughout the state. We do care about your about your health. And so we have lots of tools and resources available for you as a member to be able to monitor your own health, the well-being of your family, and we'll go over through some of those today. And so we're very mission-driven. We are a nonprofit health plan, and we are driven by making our health plans affordable and certainly giving you the care that you needed when you need it most. So I'm going to go over really quickly what the changes are for 2023. This is going through next year. So with the TRIO HMO option, which is one of the options available to you for enrollment, we are making expansions to make our TRIO plan more affordable to more individuals around California. So we've expanded our coverage for TRIO into 7 new areas or counties. Highlighted there on your screen are the counties that will be available for enrollment through TRIO effective on January 1st. So here in Southern California, I highlighted Kern, Riverside County, and San Bernardino County. I also want to bring attention to our website. This is CalPERS Blue Shield specific. So by using our website, and I'll make sure to drop it in the chat at the end of our presentation so that you have it available and you can refer to it in the future. But this will give you all the benefit information that I will be going over today, but it also gives you access to all the resources that are available as members. That includes flyers, downloads, our doctor list, our pharmacy formulary, and so much more. So here are the plans that are available to you under the Blue Shield of California option. So you have, I talked a little bit about TRIO and the counties that were available for 2023. You'll see here the other options available, Access Plus HMO. And the third option for those that are considering retirement, we do have a PPO Medicare plan, which we won't go over today just because it just deems its own presentation of itself. But today we're going to go over TRIO HMO and we're going to go over Access Plus HMO. And you'll see there on the screen all the plans that are, all the benefits that are available to you. So you'll see there included is a Shield Concierge. This is a dedicated line that holds representatives and specialists that are dedicated to provide a tailored custom a member experience. So if you call the number at the back of your ID card as a member, you'll be able to speak to a representative about many areas. If you're looking to lose weight, enroll in a tailored health program, if you have questions about your specific benefits or how to access a doctor, they are there to provide you the service that you need. Also, you have included in your benefit plan the chiropractic and acupuncture benefit. Your copay is $15. You have a 20 visit allowance. You do not need to have a referral. This is a self-referral program through the American Specialty Health Network. So as long as your chiropractor and your acupuncturist participates, you can call, make an appointment, pay your copay, and you're ready to go. Included also is the Teladoc option. So you'll see there, Teladoc is a great service. It is available on the Trio and Access program. What you get in the Trio is an enhancement. It includes also mental health, but both include the general medical coverage. So if you're traveling or maybe you, out of convenience, you'd like to speak to a real doctor that is available 24/7, you can call, make an appointment. You can do it by phone, by video conferencing, and get consultation there live while you're with the doctor. And we'll talk a little bit more about the other benefits. We certainly include mental health, also a self-referral program. Your copay is $15, and you can call directly to your mental health specialist and get care. I'm going to go and talk about Trio just a little bit, just because it's a plan that is limited to certain counties. There at the bottom of your screen, you'll see the various counties that in Southern California that Trio is available to you. So I've already mentioned the new ones. Also, that includes Los Angeles, Orange County, and Santa Barbara and Ventura, in addition to the new locations that counties that I've went over. So this is a great program. As you see in terms of benefits, this is very much similar to the Access Plus program on medical. This includes also the virtual medical appointment option, mental health, self-referral within the same medical group that you're enrolled with, and many of the resources that I'm going to cover a little bit more in detail in the next coming slides. The difference there between Trio and Access Plus is the network. Again, as you see there on the screen, it is limited to those counties indicated, but in terms of benefits, they're very, very similar plan designs. So I'm going to go over really quick. I won't spend too much time, but there's always questions about, is my doctor on Trio or is my medical group on Trio? I'm going to share with you here just really quickly, and I'll go as, I won't spend, again, too much time because our time is limited today, but you'll see there the medical groups and hospitals that these medical groups are associated with. These providers here participate in our Trio plan, and these are locations within the Los Angeles County. And so here's slide number 2, and you'll see there, again, medical groups, hospitals, and then slide number 3, you have more options there for you to select from. In terms of Access Plus HMO, this is a broad network plan. So it's one of the largest networks of doctors and specialists in California. We have no deductibles or co-insurances in any of our plans. As you'll see there on the map that's shaded in blue, these are the areas that Access Plus is available. So you'll see that it's a broad network. So it is available to you for enrollment. Pharmacy benefits. So if you're wondering about what pharmacies, how to get more information about our pharmacy network and program and benefits, this is available on our microsite or our website. So I shared that earlier. Again, I'm going to share this website with you at the end of the presentation. But if you are wondering if your formulary, your prescription drug is available in our formulary, this is a public website. You don't need an ID or a special password to enroll to get access. You can just type in the website, go into the web page, type in your medication, and it'll tell you there if it's in our formulary list, if it's a covered drug, and at what copay it applies. And in terms of the major pharmacies, we do have Albertsons, Costco, CVS Pharmacy at a Target, Safeway, Vons, Walmart, and so many more to list on this slide. You can go into our website, you can type in your zip code, and it'll tell you what's available in your area. In terms of the virtual care options, again, I covered the teledoc service. Wonderful program. I encourage all of you to take advantage of it. Again, this is a teledoc is your ability to talk to a doctor by phone, by video, and these are doctors that are able to prescribe medication. So it is a great service. Take advantage of it. And in addition to that, you do have the nurse helpline. This is available also 24 hours, 7 days a week. And this gives you the ability to speak with a nurse who will be able to provide you some guidance and information to treating any minor illnesses or injuries. Available in that feature is also a chat line. So if you prefer to type rather than speak to someone, that is an option for you as well. And so I'm going to also talk about the life referral program. It's another way of you to getting your personal assistance with any issues that you might experience if there's any life changes and or need some help with a referral. They're there to provide help for you when you need it. And it's also available 24/7. Behavioral health, I touched on it earlier. This is also included in your Blue Shield plans. It is a self-referral program, so you can take advantage of the care options available to you. We do have many ways of you to access the programs under mental health. This is either through a professional where you can self-refer and have personal sessions on one-on-one. But we also have programs that are available through applications. So you can enroll on Wellvolution. There is some great options there for you to enroll on that will help with any of these conditions as indicated on the screen there: depression, stress, anxiety, and so much more. Wellvolution, again, I talked about it. This is a great option. You'll see there some of just, 4 applications that are available. We have more programs that you can download and participate. It's a great way for you to, keep, be mindful of your health, what you need to do. And it's kind of like a safety net. It's there to remind you of the things that we all should be doing. So that's great to have it on your phone, desktop, or any other type of device. And during this open enrollment period, we have many options for you to get information. So besides today in my presentation and the breakout rooms and the chat feature that you see, if you need additional assistance, we're here available. If you'd like to find a doctor, you can do so on our website. If you'd like to see a self-guided video or listen to a presentation similar to the one I'm doing now, you can do so and view it at your leisure. And if you're interested in having one-on-one consultations directly with me for 15 minutes on the a time that's available to you, we can do that as well. And with that, thank you, Katrelia. Thank you, everyone. Really appreciate you giving me this time with you. And I'm going to hand it off to the next speaker.
Thank you so much, Alex. All right.
We're going to be talking about Anthem Blue Cross actually offers an HMO plan and a PPO. I'm going to be touching on, so we have the PERS Gold and the PERS Platinum. Using your plan, we're going to discuss the health and wellness programs and how to enroll. We offer extra support for COVID-19. You can find those details at anthem.com/CA/coronavirus. So before choosing your plan, you want to consider your personal situation, especially when it comes down to the PPO versus the HMO, and compare your costs with your monthly payment, your deductible, your coinsurance, and your copays. There are 2 PPO plan options, and this is designed to give you the freedom to find the care that is right for you. The PERS Gold is available exclusively for California residents with access to our full PPO network. And so the PERS Platinum is available worldwide. So you don't have to just live in California. You can live outside of California and actually outside of the United States. The 2023 monthly rates can be found in the appendix. So the 2 plan options and the difference, PERS Gold is available once again through the state of California, but when you travel outside of California, your benefits travel with you. Your network is access to doctors in California who are part of our select PPO network. It offers the lowest premium. There are flat copays for office visits, and your preventative care is covered at 100%. For PERS Gold members, you can earn credits to lower your deductible by participating in healthy activities, such as a flu shot, your biometric screenings, a smoking cessation class, or stating that you do not smoke. And when you sign up for the Future Moms program, you will have no hospital deductible or coinsurance when giving birth. For the PERS Platinum plan, once again, that is available worldwide. You can access our full PPO network. It has the highest level of coverage, but it also has the higher premium. It has the flat copays as well for office visits and 100% coverage for preventative care. Let's take a look at some of your benefits in the plan's network. So the PERS Gold plan coverage is 80%. Your coinsurance is 20%. There's a $1,000 deductible, and I'll refer to the next slide on how you can decrease that to $500. There is a $3,000 maximum out-of-pocket coinsurance, $10 primary care physician visit, $35 specialist or other primary care doctors, $15 chiropractic and acupuncture copay, $50 emergency room, and then 100% for your routine preventative care. The pharmacy benefits are included and they are administered by OptumRx. The plan will pay 60% of the allowable amount when you seek care out of your plan's network. For the PERS Platinum, it covers 90% of plan coverage, leaving you with the 10% member coinsurance. It offers a $500 deductible, a $2,000 maximum out-of-pocket coinsurance, $20 general or family doctor, $35 specialist visit, $15 chiropractor or acupuncture, $50 emergency room, and then once again, 100% routine preventative visits and pharmacy benefits are also offered by OptumRx. This plan as well pays 60% for non-participating providers. So if you choose the PERS Gold plan, you can take these easy steps to decrease your deductible to $500. If you have a flu shot, you'll get a $100 credit. If you let us know you don't smoke or you complete a smoking cessation program, it's $100. We want you to know your numbers. It's very important because you can't necessarily tell if you have high cholesterol or if you're pre-diabetic. So we want you to take your biometric screening. It is absolutely $0 annually, and you'll have a $100 credit. The next two will automatically be given to you. And then if you need to use it, then you will use this. It's the virtual second opinion program. So if you need a second opinion for a non-emergency scheduled surgery, and then we have a condition care program if you have asthma, diabetes, COPD, heart failure. If you participate in that program, you'll get $100. So obviously these last two will be given to you automatically if they do not apply to you. And this is good for you and your spouse. So when you're using your health plan, you can access online or on your smartphone. So anthem.com/CA/CalPERS, and you can download the Sydney Health app. You can access your digital card, you can find care and check your benefits and see your claims as well. So this is what Sydney Health looks like. And once again, as you can see here from the bottom, you can click on one of those. You can find your care. It'll use GPS to locate your nearest urgent care, or because it's a PPO, you can find a doctor that way as well. You can ask Alexa for your health plan information with Anthem Skill. So you can it's the same username and password for your member website or the Sydney Health app. And you can set up your Alexa voice profile and ask Alexa about your Anthem benefits. Live Health Online is convenient care from your home. You can access a board-certified physician from the comfort of your home 24 hours a day, 7 days a week. This is for common conditions like the flu, colds, and sinus infections. They also have the option to send a prescription to your local pharmacy. In addition, you can set up a counseling session with a licensed therapist or psychologist for when you're feeling anxious or depressed. This just goes into a little bit more about your traveling. When you're traveling outside of California, you have benefit access through the Blue Card program. And if you take a trip outside of the United States, Blue Cross Global Core program will give you access to doctors and hospitals in 190 countries and territories around the world. And they actually work with Anthem. I love this. It's my family health record. So it gives you a whole view of your entire health history. You can access that on your Sydney Health or your anthem.com website. You can view your medical records. And this is really especially important if you're going to see if you're enrolled in the PPO plan and you're seeing a doctor, you don't need a referral. So your primary care physician may not even know you went to see this doctor. Well, if you took your biometric screening, all that is located in here. So you can actually go to your new doctor, and if they don't have your medical records yet, you can simply show them your family health record on there. And you can just download it, and then you can share that also with your primary care physician, because it will include all your specialists. And then if you have a caregiver or a family member that you would like to share that with. My Health Advantage, we help you stay on track of your health by sending you reminders to make your preventative care appointments. And then it'll check for claims and routine tests. And then it'll include recent claims, personalized messages, and money-saving tips. Let's go into the health and wellness programs offered by Anthem Blue Cross. So health and wellness programs can help you become more engaged in your health, help you reach your health goals, and save money on health-related products and services. We offer a 24-hour nurse line. With this, you can assess your symptoms. You can receive the right care in the right setting. If you don't know if you should see your doctor or go to urgent care, they can help you. You can understand a condition in the course of treatment if you kind of need more information. And then if you have any questions or concerns about your prescriptions or over-the-counter medications, those registered nurses are there to discuss with you. Anthem offers special offers, and this is a discount program. So some of these vendors may change, but they give you discounts and promotions on such thing as Fitbits. There's National Allergy, 23andMe, Garmin, Living Lean, and Puritan Pride. Those are vitamins and LASIK surgery. Condition care, it's a dedicated nurse team that offers support if you're living with one of those chronic diseases. If you have asthma, diabetes, heart disease, or COPD, these are dietitian, health educators, and pharmacists that will work to help you understand and work with you to support through those conditions. Condition care support is available with the PERS Platinum Plan only. This is a registered nurse that can help you schedule your doctor's visits and dialysis, manage your condition, follow your treatment plan, and especially explain how to use your medical equipment. And this is for such things as back pain, ESRD, and vascular disease. So I had mentioned this earlier, Future Moms with digital maternity support. And this offers new and soon to be moms a lot of resources needed for a safe delivery and a healthy baby, including access to screenings and resources, a 24/7 phone line with specially trained nurses, and breastfeeding support. Anthem Blue Cross and Solara are offering a diabetes prevention program. This is a 12-month, 16-session program that can help you lose weight and lower your risk of developing type 2 diabetes. So this includes health coaching, weekly lessons, a support group, and then a meal planner and a wireless scale or activity tracker. Case management is available if you're in the hospital or have a serious health matter. They can help you answer your questions, coordinate your care with different doctors, show you how to use your health benefits, and educate you about your health issue and give you some tips on saving money and connecting with your local resources. Cancer resources. So this provides resources for you with those with cancer, their caregivers and survivors to help review the treatment decisions, develop a care plan, prepare for care, manage your symptoms, and find caregiver support. Wellve is a surgical decision support system, so it works with your doctor to explore your options. This is both surgical and non-surgical, so it will help you decide if surgery is right for you. So to enroll, you would just go to wellve.com and select register. So let's talk about how to enroll. When you choose your benefit options, you'll submit your plan selections and then confirm those benefit selections and check for errors. The CalPERS website has the resources for your open enrollment guide at anthem.com/CA/CalPERS. And there's an online digital magazine you can also visit at anthemforcalpers.com. If you have any questions, because I know I'm going through this really fast, and we do have more presentations scheduled in the future if you'd like to come back and revisit this. But we do have an Anthem dedicated customer service team at 877-PERS PPO. That's 877-737-7776. Or you can use anthem.com/CalPERS.
So with the HMO plans that are offered through Anthem, with both plans, we have our Select HMO and we have our traditional HMO. So what you can expect from the HMO plan, other than, of course, the benefits being identical across the board, no matter which carrier you go to, CalPERS design is that we all offer the same benefits, same copays, same expectation of what those benefits are going to look like. With that primary care doctor or PCP that you're going to choose, they're going to be the one who coordinates your care. You and your family members do not need to have the same doctor. You all can have different ones available to you if you have a preference, different medical groups as well. The costs are straightforward with all of the HMO plans, which is really nice. You just have your low copay. You don't have to worry about deductibles. You know your preventive care is covered at 100% as long as you're staying within your medical group and network. And and of course, no claim forms. You're just going to have your copays and you're good to go. If you are looking at switching from PPO to HMO or HMO from another carrier over to one of our HMO plans, know that we also offer continuity of care if you're already in treatment. So, based on what's going on, we may allow you to just continue with your current care team, even if you're switching over to us. And we'll certainly help you transition to your new health plan and new healthcare providers. I did mention that we have the two. We have Select HMO and we have our traditional HMO. I know the majority of you are probably in the Southern California area, which is great because you have so many options available to you. What we do have exclusive for our Select HMO members who live in LA or Orange counties, or if you live outside of that and you're utilizing your employer's address within LA or Orange County, we're going to go ahead and offer you that exclusive Vivity network to our Select HMO members. Again, this is a snapshot of the copays. It's $15 for your office visit or a specialist, urgent care, even your acupuncture and chiropractic visits. You get 20 visits per calendar year. Emergency care copay is again $50, and it is waived if you're admitted. And what's even better is that hospital, outpatient, lab tests, x-rays, and preventive care is covered at no cost to you. And the pharmacy benefits are included and administered by Optum RX. So you don't even have to worry about your pharmacy stuff. Again, copays are going to be the same, and it's all going to be housed in one place with us and Optum RX. I'm going to pop over to that Vivity because I know a lot of people do utilize UCLA Health, Torrance Memorial, Providence, Cedars-Sinai, Huntington Memorial Care, and PIH Health, and Good Samaritan Hospital. So for those of you who don't know, our Select HMO is the least in as far as monthly cost. So Vivity is an exclusive network for us. It was created between Anthem Blue Cross and 7 of the top-rated health systems, which I already mentioned, as you see below. That started in 2014. It is definitely including the top-ranked award-winning health systems, and we offer that concierge service, of course, with all the CalPERS plans, dedicated customer service team, and the Vivity also offers that speedy referral. So again, this is just another reminder of that physician-directed access through our Select HMO and also our traditional HMO. But members in LA and Orange counties do have exclusive access to that Vivity network. One of the things I do want to highlight here, if you are going to be thinking about enrolling in an HMO or if you are already with an HMO, just here first, I do want to let you guys know for the HMO members, again, if you're already with us or if you are thinking about joining us, something that is exclusive for the Anthem HMO plans is that we offer the Away from Home Care program. What that means is if you are on an HMO plan and say you have children or you have somebody on your plan, spouse even, that's going to be outside of the state for 90 days or more, whether they're going to school, working outside, doesn't matter if they're on your plan. Typically, you're only going to be available for emergency and urgent care services and that follow-up care. Well, what's great is that with Anthem, with that exclusive away from home program that we can offer to you, you can have those members outside of the state and we can reach out to our away from home guest membership program, see if that state participates and get them in touch with a primary care physician and primary medical group. So this is really going to be great again for those of you who might think, well, I want an HMO, but I have to be on that PPO plan. for them to have care. That's not true. You actually can get them that primary care physician and primary medical group from an HMO and still have members outside of the state. So that's going to be a really great option for you guys. I know we looked at that Sydney Health mobile app on the PPO, so I'm going to go ahead and skip over that. And then I do want to reiterate with the Live Health Online, it is that convenient care from your home. So if you're traveling or if you are vacationing or living outside, you can definitely log on to our Live Health Online. It is available on all of the PPO and HMO plans. It's the telehealth video visits that are currently at no cost to you. And all you need to do is have a smartphone, a tablet, or a computer that has a camera. So you're going to be able to see a board certified doctor from the comfort of your home 24 hours a day, 7 days a week. You have access to counseling sessions with licensed therapists or licensed psychologists. And again, they can even call in pharmacy prescriptions to the pharmacy if that's something that you are going to need and identify during that visit as well. So this is a wonderful, wonderful program. Again, if nothing else, certainly log in and create a username and password. That way, in the event you do need this, you're going to have access to it right away, and you can just log in and click on that and get seen right away. I've used it multiple times myself, and it's really great. It's a really great program to have. Okay, so here's that your coverage travels with you. Again, if you're traveling, you're always going to have emergency and urgent care, no matter where you are in the world. Actually, you're always going to have urgent and emergency care available to you. We do offer coverage to doctors and hospitals. We have in-network providers throughout 190 countries and territories in the world. And again, that guest membership, if you are already with one of our plans and you want to find out, and this is something that you're just hearing about, you can call that 1-800-827-6422 and see if you can get one of your family members connected if they're in one of those participating states. Okay, we already looked at My Health Record, My Health Advantage. And again, all of the same programs that Tammy covered in our PPO presentation are also available in our HMO plans. The only thing that works a little bit differently is that Future Moms program. But again, same number, same great access to information. And with that, you know what? I'm going to go ahead and turn it back over to you, Katrelia. Thank you so much.
Thank you, Wendy.
And I
And
appreciate your guys' patience.
all right, thank you both. Okay, now we have Kaiser Permanente. Sunny Smith has already moved on to get her slides up. Thank you, Sunny.
Well, thank you. Thank you for having me, Katrelia, as well as Clarita. And thank you to the audience for being here this Friday afternoon. So it's good to see everyone here today. So my name is Sunny Smith. I'm from Kaiser Permanente, and I'm the territory manager. And I will be exploring the Kaiser Permanente options that you have for the 2023 open enrollment period. So at Kaiser Permanente, we are focused on our integrated care model. So as you may know, we combine doctors, hospitals, as well as our health plan. We also have a pharmacy and a laboratory, so you can have the convenience of having access to all of your care needs in one convenient location. So also at Kaiser Permanente, we are expanding our services to meet the needs of our growing customer population. You can have access to your doctors as well as your facilities. We have the virtual connections available. So we have, you can see those numbers there of the amount of people who are seeking care with our care team virtually. So we have over 117.8 million. We have 12.6 members covered by care needs for their mind and body, also accessing care that way. Our prescription delivery system continues to operate efficiently with the 42.5 million. And you can see we have a really robust doctor, as well as specialty network. We also have 773 hospitals and medical centers throughout our network. And then if you look at the last point, we have 9 different service areas with California, both southern and northern, Colorado, Georgia, Hawaii, Maryland, Oregon, Virginia, Washington State, and the District of Columbia. So why choose Kaiser Permanente? So at Kaiser Permanente, we have a care team that is dedicated to quality care for all of our members. We have one of the largest multi-specialty groups in the nation. So we are proud of that accomplishment. Also with our digital options, we really make care convenient to our member population. We have phone appointments as well as video visits available at several different convenient times for our members. We also have care that you could seek advice around. You can contact your doctor via phone, online, or via email. Sometimes that will eliminate the need for an appointment if it's something that is non-urgent. Let's say if you need a prescription refill or something simple, your doctor may be in his care teams, may be able to resolve that by email. And finally, you'll have access to your Kaiser Permanente app anywhere you go. If you needed to look up any of your specific medications, if you needed to make an appointment or utilize any of those services, that app is a really convenient way to keep you connected to your health. And I love our membership extras. As many of the health plans stated, we have several different things built into the plan, such as chiropractic acupuncture benefits. That's also available with Kaiser. We also have the diabetes prevention program available. We also give our members different discounts on things like massage therapy, for example. We have a relationship with ClassPass, and my ultimate favorite thing is the Calm Meditation app. That is available at no cost for our Kaiser Permanente members. And we also have our My Strength app that is also available to our Kaiser Permanente members at no additional cost. Excuse me. So we talked about the convenience factor. So we definitely want our members to have access to care 24 hours, 7 days a week. And I talked about that Kaiser Permanente mobile app, as well as kp.org, that is available 24 hours, 7 days a week to address any of your medical needs. So if you had a question and you wanted to speak to a nurse, for example, an advice nurse, they are available to speak with you 24 hours, 7 days a week. They can act as a triage and also get messages to your doctor, and they can also schedule appointments, or they can advise you to seek care in an emergency room setting if they think that is the best advice. And they also will have access to your medical records when they're giving you this advice, which is very vital for them to have access to any medications you may be taking, any allergies, and also notations from your physician. Also, the ability to efficiently refill prescriptions. That's also an option with Kaiser Permanente. We have our mail order for anyone utilizing maintenance medications. You can have your medication sent to your home conveniently. You can also utilize any of our pharmacy locations, which all of our medical centers, well, I shouldn't say all except 2 in Southern California have pharmacies. Downtown Los Angeles does not, but we actually partner with a local pharmacy if you needed a prescription same day. Care away from home. So if you are traveling, our travel line is something I definitely recommend when you're planning your next trip or your vacation. 24 hours, 7 days a week, we have a home travel line available for our member population. You can also get some useful information and tips via our online website at kp.org/travel. You can get information regarding vaccinations in the particular area that you're traveling to and what those recommendations are. You can also get an extended refill on prescriptions, and you can get advice if you're seeking care on what to do if you needed to see an urgent care doctor, for example. They can let you know which centers are available in that area, and it can also take notes on any emergency services that you may be needing to seek to give your primary care doctor advance notice so they can start transitioning any follow-up care when you are back in the designated area. And then our mental health services. So we take mental health very seriously at Kaiser Permanente. So we have our dedicated team to administer mental health care to our member population. So we have a wide network of psychiatrists, psychologists. We have both the marriage and family therapists available. You can make an appointment, and you do not need a referral from your primary care doctor for these services. There's also a wide range of resources available to help you alleviate stress and reduce stress as well, improve your sleep habits, practice mindfulness, meditation, and more. We encourage you to visit kp.org/mental health to find out more of those services. And I think it's important, on another note, to remove stigma from mental health. So please, if you are not feeling well, if you are in any doubt that you're feeling different than you have been normally, please seek a medical provider or practitioner's advice. You don't necessarily have to get on any medication, but just sometimes having someone to talk to could really improve and reduce any stress or anxiety any person may be experiencing. So here are some of our value-added support services. I won't be redundant because I talked about some of them. I talked about Calm and My Strength. We also have wellness coaching by phone. If you have any specific medical area focus, so let's say, for example, you wanted to lose weight, or you wanted to eat more vegetables or eat healthy, we have these coaches available, and they are no charge to you as a member. You can set up time with them by phone, and they can definitely be your health advocate and work alongside of you to attain those specific goals that you have. Also, we have a whole list of healthy lifestyle programs available online. We have some great videos as well as podcasts. We have healthy recipes available. So some of these resources are underutilized. So at open enrollment, we really like to highlight these things because we really want you to maximize all of the benefits and services, these value-added services that are available to you at no cost as a member to help keep you healthy. And we also have, we've reinstated our seasonal farmers markets, so be on the lookout of those. For those at your local medical centers, we also have our health education classes and support groups, and LACCD is very generous. They do host several different seminars and health education classes throughout the year, so please be on the lookout for information regarding those as well. And remember, you do have chiropractic acupuncture on your plan with a copayment, and I'm going to talk more about that. Okay, so if you are not a Kaiser Permanente member and you are interested in becoming one, we have a personalized onboarding specialist that will help answer any questions that you may have, get you started, help you do things like choose a new position. You can go online and view our physician's profile, see what school they went to, view a bio, for example, and see if which doctor resonates with you, and you can select that doctor as your primary care provider. They can also help you with any transition of care needs, such as prescription transfers, so you can have an efficient and seamless onboarding experience. And it can also help you schedule appointments, by the way. And here is a benefit at a glance. So all of the HMOs have very similar, almost identical copay structures. That's just the way CalPERS and the different health plans negotiate. So you can see any doctor's office visit is $15 for regular services. So if you go to urgent care provider, for example, a specialist or your primary care doctor, you would pay $15 for that visit. Lab and radiology tests, including advanced radiology, are covered with no copayment. So that's a generous benefit there. Outpatient surgical procedures, so things that are happening the same day and you are getting discharged, that would be a $15 copayment per procedure. If you are hospitalized, however, and admitted to the hospital, for example, for let's say an overnight stay, that would be no charge. And if you are seeking care in an emergency room setting and you're not admitted to the hospital, then you would be charged a $50 copayment per visit. And then you can see the various prescription copayments, $5 for generic medication, $20 for brand. Also keep in mind, you can get a reduction on your copay costs if you utilize the mail order program for any maintenance medications. And I would like to also finally turn your attention to the yearly out-of-pocket costs. So this is not a deductible. These are simply the copayments that go towards the maximum amount that you would be required, that you would spend per year. So if you are an individual, you would never spend over $1,500 in copayments. It's really hard to get there, but that is there for your protection. So it's not a deductible. You have first dollar coverage. You only pay copayments as you go. Okay, some updates for Southern California, and I'll move quickly through this. So our care delivery, we are now open in Playa Vista. That is a lovely medical center. I've personally been there myself. We have Claremont Mesa, Hesperia, as well as Tri-City Medical Center in North San Diego County with an affiliated hospital. We are excited to announce our openings in 2023. We are opening a new WAPS medical office, and it's going to also have a remodeled learning and counseling center. And that is slated to happen on the first quarter of 2023. We also have the San Marcos Medical Center, and that was highly anticipated, and that is scheduled to open the fourth quarter of 2023. So I thank you for your time. I'm also going to be in the breakout session rooms. I believe we're still having them. And if you have any personal questions, I'll be happy to address them. Thank you so much. I'll turn it back over to the host.
All right. With that, let's move quickly to HealthNet. We have Judy here with us. Judy, would you take the mic, please?
Well, welcome everybody. Judy Blasey here. I'm actually presenting from the Sacramento area, and I'm an account manager with HealthNet, have been for about 30 years now. And I'm helping to support our CalPERS account manager because there are quite a few CalPERS meetings throughout California going on right now. So without further ado, I only have about 8 slides for you. I'd like to make this quick and painless, but do want to go over what's most important, and then I will be referring you to our website, our dedicated website for HealthNet CalPERS, potential members and even returning members to collect the rest of the information you may be interested in. So, whether you've been with HealthNet or you are coming back, we have a number of things we'll be going over here. I'm going to tell you about how to earn some rewards like some of the other plans have as well for improving your health. And again, I'll show you the custom website. You'll be able to select which plan's best for your family, whether it be one of the 2 HealthNet plans or one of the other carriers that's presented today. And I will go over the network and how to access those doctors as well. So why would you want to choose HealthNet? Well, we have been in place for over 40 years within California, and we've worked with all kinds of members through their various stages of life. We do have a couple of plans for you, as I mentioned, and these plans help us to provide you with affordable benefits. And I want to make sure that you do understand both of these. So I'm going to jump down here and tell you about them both. Our Smart Care HMO plan is a very strong benefit plan with very rich benefits. And we have high quality doctors and quite a large network of them for you to select from in hospitals. Our Salud plan is a special plan for those members. There are some that may have a unique situation where perhaps they have family members across the border, and perhaps the employee works, let's say in LA, and maybe family members need to have the care over there across the border while you're over at work. So let's say your family is across the border, they can use the Simpson network there in Mexico. And you can actually use both if you're back home in Mexico, or if you're at work over in LA, you can actually use the HealthNet network. So you'd be able to use both networks, the HealthNet or the Simpson medical group over there. I will stress that it's important for all family members to be enrolled in the same plan, however. So if you have that situation where you have any family members, dependents that you're covering over in Mexico, that you'd all need to be on the Salud HMO plan. If you don't, then probably the Smart Care HMO plan is going to be the best selection for you with HealthNet. So this just gives you a little snapshot here to show you where we are. Probably of most interest to you would be the orange, showing you that Smart Care HMO and Salud is there in the larger Southern California area. Here's a comparison of the benefits between the two plans, and you will note that both of them are the same. So even if you took Salud or Smart Care, you're not getting any kind of a reduction in your co-payments and things. So preventative care is always covered at 100%. Your doctor visits would be 15, your specialist would be 15. That's a co-payment. Your vision exams are no charge. X-ray and lab is no charge. You see that the benefits are very rich here. The MinuteClinic visits, those are with CVS Caremarks, the ones that are contracted for the MinuteClinic. There is a flyer available on our website I'll refer you to later on. And with MinuteClinics, you just have to look at the listing and see which particular CVS pharmacies are open for that. And that's just like a stop by. If it's a weekend, somebody sprains their ankle, you could step in and say, hey, take a look at this. Do you think I should proceed to the hospital or the urgent care? Maybe a child has a fever, or if you want to even drop in there for your flu shot. So it's very, very resourceful and convenient. You can see that the prenatal, postnatal visits are also no charge. Hospitalizations, no charge. Urgent care visits would just be a flat $15 copayment. Emergency care is a $50 copayment. And then you also have the chiro and acupuncture services as well, $15 a visit for 20 visits a year. And I did want to point out that urgent care and emergency care, that is covered worldwide for you. And just so you know, urgent care and hospitalization, that is, emergency and urgent care, that is, what it means is that you could have any sudden onset of an illness. Okay, so if you're in Hawaii and somebody encounters something like a really bad flu that you can't control, or vomiting, or even if somebody had a bladder infection, or maybe you thought you had strep throat and you didn't want to spend your vacation there ill, certainly you could refer to those places, drop in, and that is a sudden onset of an illness, so it would be covered. We just encourage you to call HealthNet and let them know, or talk to your doctor when you get back and let them know, so it can be documented that you actually had that that emergency or urgent care visit. So here's 3 really important programs that I always like to point out. It's Wellness with Heart and Soul. So we have a health coaching program available for you for wellness programs, surgical questions, anything that you may need assistance with. We also have a Craving to Quit program, smoking, of course, and then we have the Real Age Test, which is a health risk questionnaire. And by completing that online and then taking the results with you to a primary care physician, you'll receive a gift card. I believe it's a $50 or $100, and I'll just get onto that next because I think we have the dollar amounts. Let me just skip down real quick. Here it is. So the Craving to Quit Smoking would be a $100 gift card if you complete that program. The health risk questionnaire and sharing the results with your physician is a $50 gift card. So after you share your results with your physician, you come back to the HealthNet website and you'll sign an attestation form stating that you completed that, and then you'll be mailed your gift card. The Wellvy program I haven't discussed yet. That gives you a $25 gift card for completing that program. And I want to just jump back up to these and explain a little bit more about each of them. So the Wellvy helps you decide and prepare for surgeries. There's 3 modules that you'll complete, and then you received your gift card. And this is a great program if you're not too sure what to do, or maybe you need some support about making a decision regarding a surgery, or also the program can help you prepare for it and recover from it. The Amada program that we have is it's a program to help you lose weight and help you with your diabetes in managing that. The Minute Clinic, again, is the walk-in with the CVS Caremarks that participate in that program. We also have a nurse advice line that's available 24/7. I have used that myself, works great. I remember one evening I was standing there with my child and I wasn't too sure what was wrong with her, if I should call an ambulance. And I thought, hey, wait a minute, I work for HealthNet. Why don't I call the nurse advice line that we have available? Anyway, it's just great. And they can assist you. Of course, if you have a sudden emergency or life-threatening situation, we want to have you get to an emergency room or urgent care right away. But this is great when you just want to talk to somebody about something or get advice on where to go next. The Babylon telehealth services are spectacular. I've used those myself. They're available 24/7. And what you can do ahead of time is even go on and register with Babylon. And that way, when you call in or email them, you can let them know that you need needs of some services. And a physician usually will call you back within about 5 to 10 minutes and go over your needs with you. And they can even provide prescriptions and things like that. And they are licensed, credentialed physicians that you'll be consulting with. And that's available for all family members that are enrolled. Again, I just went over this, but it's the $150 and $25 gift card for completing those programs. Here's a slide that just kind of shows you what you'll be able to do online. You can see at the top there, and I'll have it in another slide later. It's the healthnet.com/CalPERS that will take you to your dedicated, information from HealthNet. You've got your benefit details, co-payments. It'll have your evidence of coverage there if you'd like to pull that up. You'll be able to find a doctor there in the provider search. You can order ID cards. It also goes over the discount program that we have, which there's a number of items that are discounted through our wellness program, like Weight Watchers, equipment, massage therapy, things like that. And then also it has a decision power, again, which is our wellness program. And there it is, the health risk questionnaire and things like that. All of our wellness programs you'll be able to access through there. This is how you would reach HealthNet. We have a dedicated member services phone number to ask questions about either one of these plans or to get help finding a provider or whatnot. It's the 888 number you see there on the screen. And then again, the healthnet.com-CalPERS. You plug that in and you will go right to the site and see a whole list of all kinds of items that you may be interested in looking further into. So that's it for me until we go into a breakout room, and I'll be able to assist you there as well. Thank you.
All right, thank you. Now, United Healthcare, Sandy Cisneros is with us. And Sandy, if you could, please pull up your slides and move as quickly as possible so that we can get into our Q&A. I know there's some burning questions here, but this is important that you understand how the plans work so that you can make the best decision for yourself and your family. With that, Sandy Cisneros, take the mic.
Sorry, I was on a mute. Okay, here we go. Hi, everyone. Thank you for your patience. I'm hoping this will be done and over with soon. I know you guys are ready to have a lot of questions for the health plans. I just want to show you really quick on the screen. You can see the QR code I have up there just in case you want to pull up United Healthcare's basic HMO plans, our website, what's available, the benefits, the tools, and the resources. All of that is on there. If you can scan that QR code, you can pull it up on your phone, on an app, and that should be it. So with that being said, my name is Sandy Cisneros from United Healthcare. As a CalPERS member, United Healthcare is one of your medical health plan options to choose from. Today, I will provide and help you understand your United Healthcare HMO medical benefits, tools, and resources. If you have questions, I will be able to answer them after the presentation and during the Q&A breakout session. For specific or personal questions, I do ask that you please call our dedicated customer service number, which will be provided at the end of the presentation. Okay, let's get started. Knowing your benefits helps you make more informed healthcare decisions. As a member, you'll receive tools and support to help you save time and money and find care when you need it. United Healthcare offers 2 HMO plans to choose from, Signature Value Alliance and Signature Value Harmony. I'll go over some of the details and benefits you can expect from your chosen United Healthcare plan. The Alliance HMO plan is available in 26 counties throughout California. It's an original health plan offering with a distinct subset of United Healthcare network providers who collaborate on your care and help you manage your health. You can choose from over 35,000 physicians and 250 hospitals. Coverage outside of California HMO service area includes virtual visits, emergency, and urgent care only. Please go to uhc.com/CalPERS for a full list of doctors and hospitals. The Harmony HMO plan is available in 5 counties throughout Southern California. You can choose from over 17,000 providers in 175 primary hospitals in LA, Orange, Riverside, San Bernardino, and San Diego counties. Focus on the physician-patient relationship and designed to be affordable, Harmony members have a streamlined service experience made easier by technology, simpler tools, and the integration of care and coverage. Coverage outside of California, once again, HMO service area includes virtual visits, emergency, and urgent care only. Now let's go over your HMO medical benefits. This is quick, right? To help you manage your health care, United Healthcare Alliance and Harmony HMO plans require each enrolled person to select a primary care provider from the plan network. You can easily search for a provider on your website at uhc.com/CalPERS. If you need to see a specialist, your primary care provider will need to submit a referral. Referrals are not needed for OBGYNs, chiropractors, and acupuncturists, as long as they are in the network. Coverage is available only when you use a provider in the plan network. If you use an out-of-network provider, you will be responsible for the entire cost of the service. The exception is emergency and urgent care, which are covered wherever you are. When it comes to paying for network care, here are some examples of basic costs. There are no deductibles or co-insurance. Preventative care, of course, is 100% in our network. The copay for a primary care provider and specialist visit is $15. Emergency services have a $50 copay, which is waived if you are admitted to the hospital. Chiropractic and acupuncture is also included. You can receive 20 combined visits per calendar year at a $15 office visit copay. For full coverage and details, to see your official health plan documents, which can be viewed and downloaded at the website uhc.com/CalPERS. OptumRx is your United Healthcare Plans Pharmacy Benefits Manager. It's committed to helping provide you with easier and lower cost ways to get the medication you need. With OptumRx, it's easy to save on medication. If you choose to receive your prescriptions by mail, you could get up to a 3-month supply for 2 copays and save a trip to the pharmacy. If you have questions about your pharmacy benefits, you can also contact OptumRx at 855-505-8110 or optumrx.com/CalPERS. And I know Christine is here with OptumRx and she'll be presenting on this as well. Searching our network is easy. If you have a primary care provider, make sure they're in our Alliance, Harmony, or Harmony network before you visit. There are a few ways you can search our networks. You can look for the Search for a Provider tab on uhc.com/CalPERS to use our online search tool, where you can search for physicians by name, specialty, or zip code. You can also download a copy of our Find a Doctor guide for step-by-step instructions, or contact our customer care advocates at 877-359-3714. Virtual visits. Virtual visits let you talk to a doctor by video or phone 24/7 without an appointment for common conditions like the flu, coughs, infections, and more. These services have a $15 copay. So with virtual visits, doctors can diagnose and treat a wide range of non-emergency medical conditions. And if appropriate, they can also send a prescription to your local pharmacy. The United Healthcare virtual visit providers are Optum, Teladoc, Amwell, and Doctor on Demand. Members can learn more or start a virtual visit by going to uhc.com/virtual visits or uhc.com/CalPERS. This is a great benefit when you're traveling on vacation. And this is also, I know, have been covered by the other carriers, that if you happen to use your virtual visits, if you're on vacation, like they said, traveling, it's a great benefit and you don't have to worry. You can just log in and the physician can help you. Supporting you and your emotional well-being. United Healthcare is using virtual technology to help expand access to behavioral health care. Members may seek care from providers in person, virtually, or a combination of both. Get connected to self-help digital tools, behavioral health providers, and other resources that can help with a variety of concerns such as depression and anxiety, relationship difficulties, alcohol and drug use recovery, meditation, mindfulness, stress relief, and so much more. For more information on your behavioral health benefits, you can visit the website or contact our customer care advocates. As part of your wellness resources, you also have support to help you lose weight and keep it off. Real Appeal is an online weight loss program designed to help you lose weight and keep it off. The Real Appeal program includes an online coach for encouragement so that you can create a healthy, lasting change. A success kit with a digital weight scale, food scale, recipes, fitness equipment, and more. You'll also have access to motivational resources to set goals, track your progress, and stream workouts using your online dashboard. We also have Simply Engaged. Integrated with Rally, Simply Engage is an innovative, simple digital wellness program designed for you to take control of your health and have fun earning rewards at the same time. When you complete certain health and wellness actions, you'll earn rewards up to the maximum for that reward. Covered employees and covered spouses or domestic partners can earn up to $200 in gift cards and rally coins. Available tools and programs include health survey and video, biometric screening, coaching programs, rally missions, and gym check-ins. United Healthcare is committed to adding a variety of health and wellness options. As part of your benefits, the Peloton app is available at no additional cost to you. UHC members get a 1-year Peloton digital membership. It includes thousands of fitness classes, flexibility to get active anywhere, anytime, and ways to help you have fun and stay motivated. So to learn more, you can go to uhc.com/Peloton. Our customer care team is available by phone to help answer any questions you may have. You do not need to be a United Healthcare member to call and ask questions about our benefits. You can scan the QR code with your phone or visit our website at uhc.com/CalPERS, where you will find all our benefits, information, and more. If you have more specific questions, please call our dedicated customer service line at 1-877-359-3714. They will be happy to help. Thank you for allowing me to present your United Healthcare plan options. I hope this information was helpful. This concludes my presentation.
Thank you so much, Sandy. That was perfect. And now we're going to ask OptumRx to take the mic as I load their presentation. Just a second here.
I will try to go through this very quickly as you have sat through 2 hours of presentations. So my name is Christina Fountain. I'm from OptumRx. We manage the CalPERS prescription benefits for the basic plan. If you can switch the slide, please. And we manage it for all the health plans except Kaiser or Blue Shield. So all of the ones above, we do manage. Next slide. So the way your plan works is it's the preferred 90 program. And this is basically if you take a maintenance medication. So that's any medication to treat an ongoing chronic illness such as diabetes, high blood pressure, cholesterol, you want to go to a preferred 90 pharmacy. All Walgreens and Duane Reads are your preferred 90 pharmacies, as well as OptumRx home delivery. Next slide, please. What this allows you to do is get 90 days of your maintenance medications at a 60-day copay. So 3 for the price of 2 if you go to a preferred 90 pharmacy. However, if you go to a non-preferred 90 pharmacy, you can still get 90 days. You just don't get the copay savings. So for 90-day maintenance medication, say at a CVS, it would be a 90-day copay. Next slide. So an example of getting this versus, say you're getting an inhaler and you're getting it for $20 a month. If you were to go to a preferred 90 pharmacy, you would get 90 days at $40. So that would be a savings of $80 a year just on that one medication. Next slide. We do have an OptumRx dedicated website for CalPERS members. It's optumrx.com/CalPERS. On this site, you can find which pharmacies are in network, price out your medications, see if your medication is covered on the formulary, what tier it's covered under, and if it needs any prior authorizations. Next slide, please. So if you want to see which pharmacies are in network, you would select which plan you're in and look up either by zip code, city, state, or a specific address. And you can also filter it for more advanced searches. Next slide. And that will bring up a list of all your in-network pharmacies. Next slide. If you want to see how much your medication will cost, you would just, again, pick which plan you're in and put in the zip code. So it'll bring up the pharmacies in the area, as well as once you put in the name of the medication, you want to edit it for the right strength and the dosage and how many days supply, and it will bring up a price for you. Next slide. That's where you would edit this and apply the changes. Next slide. And that's where you would see the different pharmacies, how much it would cost, as well as through home delivery. As I discussed, some medications may require prior authorization. So with the medical side, you're used to prior authorizations when the doctor says, I need to get insurance company approval before I can run any tests. Certain medications also need the insurance company approval before it is covered on your formulary. And how do you know if your medication needs a prior authorization of any kind? Next slide, please. If you go on the website, you can see on the formulary listing there, are there any special requirement coverages? And if it says SP, that means it's a specialty medication. If it says PA, that means it's prior authorization is needed. And you would just let your doctor know that you need a prior authorization, or you can call our customer care, and they're open 24/7 to get to initiate a prior authorization. We'll fax your doctor for one. Next slide. We also have an OptumRx mobile app, so for Android as well as Apple phones. And this is great to have with you, because if you are in the doctor's office and they want to prescribe a new medication, you can pull up the app, look on the formulary, see if it's covered, see if there's a lower cost alternative, or see if it needs a prior authorization. And you can discuss all that with the doctor while you're in the office, because once you leave the office, it's much harder to get a hold of somebody there. Next slide. So if you have any questions, I went through it really fast. You can feel free to come into the breakout room, or you can always call our customer care representatives at 855-505-8110. Even if you are not currently enrolled in a plan that has OptumRx, you can just let them know you're thinking about it. It's open enrollment, and they can answer any questions you may have. They can tell you if medications are covered, if it needs a prior authorization. They can price out medications for you. They can check to see which pharmacies are in network in your area. Thank you.
Okay, thank you. All right, so now we're going to move into the breakout rooms. Please be aware,